Okay, so thank you for attending our third expert exchange session. I would like to introduce Dr. Cohill, who is currently an assistant professor and doctorate coordinator at the University of St. Augustine Occupational Therapy Program, and she is based in San Marcos, California. She's worked as a practitioner for over 30 years in Colorado, Utah, and Oklahoma in a variety of areas of practice. Noting a shortage of early intervention providers in rural communities, she's participated in the Early Intervention Colorado Telehealth pilot program, and that pilot program resulted in the development of the Telehealth online learning modules for Early Intervention Colorado for the Colorado Office of Early Childhood. She's also currently providing telehealth, early intervention occupational therapy for Pueblo, Grand Junction, and San Luis Valley in Colorado. And she's been providing telehealth for the American Samoa Helping Hands EI program for the past 3 years. She's a 1990 graduate of Colorado State University and completed her doctorate of occupational therapy from Rocky Mountain University of Health Professions in 2014. So I think this is going to be an amazing session, and thank you, Dr. Cohill, for sharing your expertise with us. As a quick note to everyone, as I mentioned, this session is being recorded. I will share this to the Keep Teaching and the Keep Learning pages for the university, and also a PDF of the PowerPoint presentation. So with that, I will turn it over to Dr. Cohill and hand it off to you right now. Thank you.
Great. Hopefully you can hear me. Just wave at me if you can't hear me. And since we're kind of a small group, if you wouldn't mind turning on your cameras, I'm totally great with that. That way, if you need to flag me down, it's easy for me to see. So I've got my chat up. Please feel free to chat me if you need to. We're going to talk about telehealth, all things telehealth, and you're going to see my sparkle and excitement kind of kick in because I've been working on this project for quite a while. I kind of talk about it like it's a baby. So this little baby that I started back in 2014 as a doctoral capstone project for my post-professional at Rocky Mountain. And what I was doing was I was an early intervention provider, and I loved the early intervention model of the natural environment and the coaching. And I was realizing that we were really short providers in our area. And so I started kind of thinking, and you know how you go down that Google hole? You know, when you're Googling things and next thing you know, it's been 3 hours. Well, that's kind of how I found telehealth. And I will say that the speech profession was way further along than OT at that point. So I started going into speech and ASHA and all these things, and I found telehealth. So I started kind of making those connections in my head of how could this work? And at the same time, so any of you who are in a doctorate program, you understand that you're doing literature searches, you may have to do surveys. So I reached out to my program that I was working with in Colorado, and I said, hey, I have this idea, what do you think? And they said, oh, the state is working on the same program. So luckily, as I move a lot quicker than a state would, and the state program took us about a couple of years to develop all the legislation that we needed to get into place and all the regulations and all the information for the telehealth pilot program. But we developed that in Colorado for this reason. So it started off a little baby, and a lot of people kind of roll their eyes at me when I start talking about telehealth, and they're like, oh, telehealth, what is that? No way, I can't do that. And then all of a sudden COVID hits, right? And so telehealth has now turned into an adolescent, and it's out of control. And I am busier than I've ever been training other people on how to do telehealth. And I really do think that it's a labor of love in some ways, because I've been able to provide the information to other people so they don't lose their jobs, so they have a way to access, so the families have ways to access the therapists. So I've been doing a lot of trainings and coaching. I also am lucky enough to work, this is a picture of American Samoa, and I provide early intervention telehealth services in American Samoa. So what's really fun about that is we do it a little different than we do here in Colorado, but it still works. And it's still a really valid, positive experience for the families and for the service coordinators in American Samoa. So if you want to talk about American Samoa, hit me up, email me, and I'll tell you everything you ever wanted to know about American Samoa. So what I want to know about you is I want everyone to turn their cameras on. So everybody turn it on. And I'm going to ask some questions, and when I ask you questions, I want you to turn off your screen. So let's start with, has anybody used telehealth for a family member? Has anybody used telehealth for themselves? Ooh, look at this. Has anybody used telehealth to provide services yet? Just turn off your screen if the answer's, wow, everybody's still here. Okay. So does anybody have a dog? Turn off your screen if you have a dog. Okay, I just wanted to make sure my speaker was working. So I knew we had some dog lovers out there. Okay, so this is new to you, and that helps me to gauge kind of how much of the nitty-gritty we're going to go into. So I'll get to that point. I've also created a Padlet for everybody. And so on that Padlet, you'll be able to find some resources that I put up. I put up APTA, ASHA, I put World Federation OT information. I put information about some evidence to support telehealth. So I put a lot of information there. And then I have a question section. So if maybe 2 days from now you're thinking about my talk and you're laying there at 4 o'clock in the morning and it comes to your mind and you have a question, you can write it in there, okay? And I'll answer on the Padlet for you. So I also have created that, and I'll give you the link to that in a little bit, okay? So learning objectives, we're going to talk about telehealth. We're going to talk about the benefits. I'm going to talk about different cases, when it's appropriate, and how to integrate it into a case example. And one thing I want you to know is that with COVID-19 right now, things are different. I'm going to teach you the way it's supposed to be, okay? But understand that it may change, okay? I really had a hard time keeping my feet underneath me for a while because it was changing so quickly. And everything was, the regulations were changing and licensing was changing and HIPAA was changing. HIPAA, can you imagine HIPAA changing? It did. So all these different changes were happening. And I imagine some things are gonna swing back the other way, but hopefully it swings kind of in the middle and it won't be as restrictive. Okay, so Jim Hinojosa. Telehealth. We are living in a time of rapid and unpredictable change. Advances in knowledge and technology have made our lives more interconnected and complex. This is my all-time favorite quote. Anybody who's had me in class, this is my favorite quote. So if you are playing trivia night, you can say this is Cohill's favorite. And the reason it's my favorite, if you look back, 2007, that was 13 years ago. The iPhone, the first iPhone came out in 2007. Okay, so think about the forward thinking of Jim Hinojosa to say this, and look at where we are now, right? So I really think when I am looking at programming and I'm looking at technology, I kind of embrace it in this time of rapid and unpredictable change and the forward thinking of Jim Hinojosa. Okay. Okay, so what is telehealth? Let's talk about telehealth. What is telehealth? Telehealth can be different things to different people, but for AOTA, it's the application of evaluative, consultative, preventative therapeutic services delivered through telecommunication and information technology. Okay. APTA also has a statement. It's the use of electronic communication to remotely provide healthcare information and services. As you're looking through the research and you're looking for information, you may have to look at telemedicine, e-visits, video visits, telemonitoring. There's lots of different words that have came up for telehealth, but it seems like we're starting to kind of settle into the telehealth mode, and that seems to be the lingo that we're all using now. Okay, it's really, this is the one thing, if you don't get anything out of my talk, please get this. Telehealth is a service delivery model. So what does that mean? That means if you were practicing OT in the time of COVID and all of a sudden everything went virtual and you had to use telehealth, you did not need to go get a separate doctor's order for telehealth, right? There's a lot of things you do have to think about, but one of the things to think about is you're still an occupational therapist, physical therapist, speech therapist, right? So it doesn't change. It's just the way you're delivering those services. So that is so important, because what happens is our third-party payers, our insurances, our licensing boards, our regulatory agencies, they need to understand that telehealth is a service. It's not separate. We don't need regulations just for telehealth. Now, as OTs, we have an ethics statement, and I did post that on the Padlet for everybody, just to let you know. But other than that, we don't need, it's not a separate service. Okay, and sometimes therapists get a little hung up on that. So I really want to make sure that you understand that it's just a way of delivering services. Okay. So the elephant in the room and the common myths that I see. I found this picture today and I was giggling. So those of you who know me get that. So a lot of people, a lot of therapists, I've heard a lot of different things, but I became a therapist to work with people. I want to put my hands on. And my answer to that is typically, so what happens the other 23 hours a day when you're not there? What is happening? What's happening in the home? What is that client able to do on their own or with a family member when you're not here? How does that work? So that's, I'm still working with people. I do fist bumps through the computer. I blow kisses to the kiddos. Yay, good job, Miss Becki. I've taught little guys to say Becki. And it's pretty fun because my name's really easy for kids to say. So moms kind of get frustrated with me when I teach them that first. But a lot of kids, so they know who I am. They know what I'm about. The parents will send me videos of first birthdays, second birthdays, third birthdays, sixth birthdays, things like that. So I'm still a part of the relationship. That therapeutic relationship is still there. I have therapists who say, oh, that's great. I can sit at Starbucks and I can FaceTime. And you'll see that even though we are on lightened HIPAA requirements, that's still not HIPAA compliant. Okay. So typically if I'm traveling or if I'm in between places, I will use my password protected hotspot and I sit in my car. Some of you may have experienced that. And then also that would be so much easier. I do want to say that telehealth is not easier. It's really challenging. It's really challenging. You have to be able to think on your toes and you have to be able to look at the environment of the clients and also have the goals in mind. So the one very cool, fun thing that I think is I am a better therapist because of telehealth, because I'm able to see more. When I'm in the moment and I'm working with a kiddo, I work mostly pediatrics, but I have some applications for adults. But when I'm right there and I'm with the family and the siblings are crawling all over me and things like that, sometimes I don't see everything. And so by being out and being able to see the environment and the person and what's going on in the entire room is really helpful for me. It is HIPAA compliant, but there are some rules, and we'll talk about that. Technology. All of you at University of St. Augustine, what a great thing you have, because you're so used to these Ring Central Zooms, Blackboard Collaborates, all these different technologies that we use. You're used to that face. When I first started telehealth, I had never done FaceTime. I just had this idea and I thought, well, let's go with it. But as you can tell, I've learned my technology face, and I'm able to get my energy through the technology. And most of the time, I can get the technology to work for me. I've had one case in my time where the technology did not work, and that was a child who lived at the bottom of a hill out, and we just couldn't get cell phone service. They didn't have internet, and it was early on in telehealth, so it was really a challenge. But in American Samoa, I'm able to provide services, and we use a cell phone connection there. And again, telehealth is not a specialty service, okay? Okay, so why? Why in the world would anybody want to provide telehealth besides COVID, right? So one of the things about telehealth that's fabulous is that it gives us the ability to provide services in the natural environment. So think about the clinic setting, and that outpatient clinic setting. We would be able to, we're shut down, COVID has shut us down. How do we provide services? How do I do what I would have done in the clinic in the home? Okay, and what kind of carryover are you going to see in that natural environment? Are you going to see more carryover because you're able to use the kitchen, underneath the kitchen, for your client to reach under and grab the spray bottle of Clorox? I don't know, I just made that up. But reach underneath the cabinet and get the Clorox and wash their counter. Maybe they've had a CVA or something, versus you simulating that entire activity in a clinic, which still won't be right? And I'm not dogging outpatient clinics, because there's a place and a time. But the thing about telehealth is it gives us that ability. It opens that door. Even if the client comes in one time a week and then the other time is provided in the home. Okay. Some interesting statistics that I found is that 70% of older adults are connected to and use the internet, and that 58% of adults say technology has had a positive impact on our lives. So the idea that somebody won't be open to technology because of age or where they are in their life is going away as our population is aging. Also, another one I found today was 81% of Americans own a smartphone. So the smartphone, because I was looking at disparities, and we'll talk about that next, but using a smartphone is just as valid, and it works just as well for telehealth. Okay, I used to be against it, but I'll tell you why later. It also improves the skills of caregivers, and it also empowers the client and caregiver to be team members. We all have to work together. So when I'm working with either a child or an adult, and I'm working with them on a skill or a task that we want to accomplish or they want to accomplish, I have to use my words to explain, and I have to have them be my hands. I can't put my hands on. I cannot put my hands on that child through the screen. I've tried. I've wiggled my tongue around. I've tried to figure that out. I can't do it. So it empowers that parent, the client, the caregiver to be part of the team and to be able to reach their goals. Okay, so health disparities. So this was my reasoning for starting into telehealth, and I have heard from therapists, but what about the people who don't have internet? What about people who don't have computers? Now, there are those cases. Telehealth is not for everybody, but this is where we need to advocate, and we can advocate as OTs to get internet, to get more connectivity to all our population, to everybody. There's areas where I live where there isn't connectivity. As I'm driving to the airport, I have an hour and a half with no cell phone, no internet service, nothing. Those areas need to be connected. Okay, so this is a place where we could really advocate. So looking at transportation, looking at the rural communities, looking at people who don't have access to transportation, therefore don't have access to healthcare systems because of the lack of transportation. Or maybe they do, maybe they're going to a pediatrician, but the pediatrician is an hour and a half away and they don't have a car. Or maybe they're in an urban area and they'd have to take the bus. Okay, so that transportation can be a big issue for a barrier for healthcare. Childcare is another issue. Using telehealth, you wouldn't have to take your other child to childcare, or you wouldn't have to take your child to childcare. Improved monitoring, it's easier for the physicians to monitor their clients. Timeliness, we can, I get a referral, I can usually schedule pretty quickly because I don't have to schedule into my drive time, or the client doesn't have to schedule to come to see me. It's a little bit easier. Lower costs, less time off work, and access to providers. Think about access to specialists. Think about rural communities. I'm big on rural communities, but being in a rural community where there is no pediatric GI specialist. It's 2.5 hours away for a pediatric GI specialist. How can we connect people using telehealth? Feeding specialists in OT are a big thing in my area. How do we connect the children to a specialist in the area of feeding and do coaching? But that's another talk. Okay, so the benefits for therapists: decrease our travel constraints, reducing health-related cancellations. If I had the sniffles and I had to go see a client or a kiddo who had a heart transplant, I wouldn't go, right? I would cancel that appointment. I could see that child now using telehealth. So maybe I do something like a hybrid. So maybe I see the family or the client either in the clinic or in the home, and then sometimes we do telehealth when maybe the sibling is sick and I know that my caseload is full of kiddos with decreased immune systems. Okay, so it gives us that option. It's another tool in our toolkit that we can use to provide services. And again, I'm gonna get up and scream it from the mountaintops: engaging clients in their natural home environment. We can see everything going on in the home. We can see the interactions. We can see the people coming in and coming out and all those fun things. Provides access to qualified providers. If I need a consult with a speech therapist, it's a little bit easier for me to do via telehealth. Gives us lots of opportunities to work as a team in American Samoa. There's a speech therapist, there's myself, there's a psychologist on the team. We're all remote. Sometimes we're all in an evaluation and we're working together, all of us in American Samoa. And opportunities for mentoring and supervision. So as students, if you wanted somebody to mentor or your supervisor was at a different school than you were at, you could do it that way. Okay. Okay, so very important part of doing telehealth is planning. Okay, there's a lot to it. So making sure there's an adult who has a cell phone number handy, just in case. You know, things happen. You guys all know from being at school at USA, technology happens, right? So we want to have a cell phone handy. Spend that first session, spend that 10 minutes, allow yourself to work on the technology. It is okay. find the way that you need to position the camera. Sometimes if I'm working with kids, I'll put a blanket, have the parent put a blanket on the floor, and as long as I can see that blanket, I can see the kiddo, right? So we do things like that. Creating visuals, you might need to do a visual in screen share. You can do PDF with icons if you need to. You can use the whiteboard. Frequently, I'll be talking with somebody and I'll go, oh, wait a minute. Have you seen those sippy cups? I'll Google a sippy cup that I want and I'll share it to the parent, and the parent, oh yeah, I've seen those at Walmart. Yeah, no worries, I'll get one of those. So that's really cool to have that access right then and there. Allow for the client to request a break. This is a lot of information coming in. There's different things you can do. If you're working with somebody who gets overstimulated, you can use earbuds. So the person that you're coaching or you're talking with about strategies could wear earbuds and the other person can't hear. You would do this mostly with kids. So the kiddo's not hearing your voice. You can turn off your video if your video is overstimulating. Okay. So, and also mobility. If you're working with people with low balance or poor balance, you want to really take into consideration safety and really make sure that they're in a safe place or they have a caregiver or a helper. Okay. So before your session, this is why I always say it's not easier. It takes a lot of time to prepare for a session. So make sure you have your screen share ready. If you're going to show videos, sometimes as much as I try and as much my 30 years experience has given me with pediatrics, sometimes I really have a hard time explaining to a parent what I'm trying to do and trying to help them do. And so sometimes videos are great. There's some short little videos I show, and it's like, oh, that's what you want. Yeah, that's what I want. Because I'm just using my voice, trying to explain. If you put your hand here and you put your hand here, those kind of things. Practice, practice, practice. Talk to each other. Talk to other people on screen. Try to coach each other on how to do things. If you think you're going to do 3 activities or 3 things with somebody, plan 6. That way you feel like, okay, I got this. Okay, so double what you're going to do in person, because sometimes it goes a little quicker or it's not successful. Okay, I always send a pre-session email. I always say, looking forward to seeing you. Here's the link for today. And I also do, if we're doing a feeding session, can you have something crunchy? Can you have something messy? Can you have maybe, remember last week we did the Cheerios? How about let's have some Cheerios there? So I let the parent know what to expect ahead of time, okay? And then I also make sure that I explain telehealth. And my very first session, I talked to the parents about the parents or the caregiver, their role in the sessions, that their role is to be my hands, and that this model that we're using has got really good evidence, but it needs to be a communication between all parties. So I'm going to coach you on some things to do that you can do with your child or your caregiver or your partner. And if it doesn't feel right, you need to let me know. Or if you don't think you're getting the results, you need to let me know. Okay, I'm here to give you strategies. So really talking about the importance of the adult in the room. The adult in the room is really important. I think most failures in telehealth are coming from OT, PT, speech who are trying to take what they would do in person sessions and do the same thing on telehealth, which you can have the same goals and same ideas, but it's going to be modified. It's really challenging to work with a 2-year-old for 45 minutes to an hour and engage them in the screen. It's not going to happen, right? So you have to use your own therapeutic use of self, and you have to coach the parent to empower them to become the provider. Okay? Okay, I'm so excited. Okay, so flow. Always think about what you would do in person sessions. What would you do in person? I just said don't think about that, but think about what would carry over. What would you do in a session? You would check in with your client, right? You would say, how's it going today? You know, how's your week been? Are you experiencing any more pain in your shoulder after last week? Or how's the exercises going we talked about? Or, you know, were you able to make tortillas for your husband this week? Okay, so what do you do face to face? Then typically find out what they want to do. Okay, what is your goal for this session? What do you want to do? So that's what I mean by flow. Okay, what would you do typically? And at the end, you're going to wrap it up, right? You're going to do a wrap up session. You're going to talk with the person about the strategies you suggested, give them 1 or 2 things to work on. Do the same thing in telehealth. Okay. Also, you want to make sure you really look at the environment and how you can use it to support your session. And I talked a little bit about being that fly on the wall, which is really nice, but knowing what supplies they have available, knowing what is the room really distracting? Is it quiet? Are they sitting? You know, where are they sitting? Are you able to move around? Safety, safety, safety. And make sure the camera's in a good place. And it's okay to say, hey, can you move the camera? I can't see the whole picture. And most people have gotten really good at that. And that's why I really enjoy using the tablets and the phones, because they're mobile. You know, it's not like a big computer system you can't move, but those, you know, some days I'll be working with a child and we'll be in the house and we'll do some work around the feeding routine, and then the next thing you know, wants to go outside. Okay, we're taking the tablet and we're going outside, and then we're going up the slide and we're jumping on the trampoline and all these fun things. So really think about the environment and what we're going to use. Okay, coaching. This is my soapbox. I love coaching. Coaching is, and I could do an entire lecture on coaching, and I would love to do an entire lecture on coaching. So if you ever want a lecture on coaching, please let me know. So coaching is an interaction style that promotes active participation, okay? So this is what we do to empower clients. So we help them to learn how to develop their own goals and how to develop their plans. So one thing that has happened with me, and I know I'm talking a lot about pediatrics, but you can see where this would go with adult clients also. But I'm going to give you an example. I'm working with a child. I've been working with this child for over a year. Mom's goals are to get him, instead of doing this all the time, to go like this and hold himself up. He's a little, almost 2. And he's not crawling, has complicated diagnosis. So we've been working. I've been giving her strategies, lots of different strategies. This is Mom's goal. She really wants him to pull himself up and to crawl. And so the other day, she comes into the session and she goes, I have something to show you. And I said, great, what are you going to show me? And she figured out, after all these times of me saying, okay, so to get weight bearing on those arms, to get his arms forward, to get weight bearing on those arms, she decided that she was going to dump him off the couch onto his arms, and he sits there just like he's been doing it all his life. Sits there, plays with the toy, watches the Kindle. Look at this. I sat there for the whole time. She came up with that idea, okay? I talked with her about what I was looking for and how we could do it and different ways to do it and different things. But until she took ownership of that and it went, wait a minute, he's weight bearing, then it became a part of their daily routine. Okay, so that's what we're looking for. So having those caregivers, those family members take ownership of it and think what's going to work for them. I'm sorry, I just get excited. It helps the caregivers implement the plan so we get better carryover. Okay, so when it's going well and I have a family that's really engaged and things are working right, typically 30 years of practice, I'll be like, okay, this kiddo probably a year of OT in early intervention. Next thing I know, in 4 months, we're like, every other week. Mom's like, yeah, that'd be great. Next thing I know, it's monthly. Next thing I know, it's just when we need you. I just want to check in because sometimes you have really great ideas. So that's happening because those families are implementing that plan and things quicker. Okay. They get to evaluate, well, that didn't work. Well, that did work. Develop new plans as needed and recognize the results of their own actions. Okay. So we are going to fly through the details because this is kind of the stuff, but I have this PowerPoint for you on the Padlet, and I'll give you that. And this is kind of the boring stuff. So we're going to kind of go quickly through this. But evidence, technology, HIPAA, licensing, reimbursement. This is all things you have to think about. So telehealth does take a little bit of thinking. You have to look at AOTA. Yes, they're all about telehealth. They're good with telehealth. They understand it. They have an ethical statement. We have policies. We're good. AOTA, APTA, ASHA, good. But then you have to break it down even further into licensing, into reimbursement, into HIPAA, into technology. You have to look at all of these things before you provide services, okay? So there's evidence supporting telehealth. Reviews of the evidence indicates that outcomes are the same or higher than traditional methods. Anecdotally, I see that. I'm working on some research projects. I think I have 3 going right now on telehealth. One on the parents' perspectives, one on the therapist perspectives, and then also we're working on a randomized control trial. We're working on the grant funding right now, which has been kind of sticky. But we're working on that to kind of give some meat and potatoes. It's a newer thing, and so believe it or not, there's evidence out there, but there's not as much as we would like. But it does indicate that there's a high level of caregiver satisfaction with telehealth. Okay. So like I said, compliance. You have to be aware of the current policies. This is really challenging right now, I'll be honest with you, with COVID. It's just a roller coaster ride. It's happening so fast. I can't keep up. I'm trying to keep up, and I did give you some resources on the Padlet that you can go to. Licensure varies state by state. Reimbursement codes, typically we bill the same as we would in-person services because remember, it's not a different service, right? But then some states are putting modifiers on, so you have to just know what's going on in your state. You are responsible for that. Malpractice insurance, I actually carry an extra HIPAA waiver on my malpractice just because, first of all, Colorado requires it for early intervention, but also I would do that anyway because I do all telehealth. So it just kind of gives me a little bit of peace of mind. It's not required, but I do it. Okay, this is the most important slide ever. Okay, I'm going to put this in the group chat at the end. So hang in there with me, and because I can't figure out right now how to copy it without getting out of here. So this is the most important slide. This Padlet has everything you ever wanted to know about telehealth, okay? And this presentation will be listed there. Okay, you got to look at technology you're going to use. Make sure I use what's existing in the home. That's my thing. I think a lot of therapists are doing that at this point with COVID, but I really feel like that's what the family's comfortable with. That's what I'm going to use. That's when the cell phones come in. At first, I didn't like cell phones until I worked with a family, and that picture with the cell phone was better than I'd seen on computers. The sound was better, everything was better. And so mom would just prop it up right in front of the little one's high chair, and we would do our thing. And it was great. And it's mobile and it's portable, and you can use cell service if you don't have internet. So cell phones are kind of the bomb these days. I'm kind of liking it. But you also have to pay attention to the person, the adult that you're coaching, fine motor skills, hearing, visual acuity. All those things are really important with telehealth. And you may have to problem solve some of those. So I try to use what they're used to. Okay, so I have some pre-COVID and post-COVID quickie slides for you. Technology platforms, oh my goodness, there was none, and then there was a million. Pre-COVID, we had a limited choices. They need to be encrypted on both ends. That means password protected on both ends. And typically I would use a laptop because I felt like it was better. Now, post-COVID, people are able to use FaceTime, Skype, which typically we can't use because they're not HIPAA compliant. Phone calls are now okay during COVID, but then you have to watch out for Zoom bombing, where people just show up. So making sure that you're password protected. Okay, that was something I never had heard of before. And there's a lot of free trials out there. DoxyMe had one, VC had one, a lot of the different platforms. And when I say platforms, I mean the technology, the video conferencing. A lot of them have different free trials. Okay, HIPAA. You keep hearing me say HIPAA went away. Reasonable and best effort is what it says in this little blue release. So that means you still need to try to adhere to HIPAA requirements, but they also understand that families are working together now. Sometimes there's multiple family members staying in the home. Prior to COVID, encrypted, having rehab professionals only doing synchronous video. Now a lot of therapists are doing asynchronous, so the family will videotape a routine or something that's challenging because it's just too much for them to engage when their 6-year-old and their 4-year-old are home from school and they're trying to work with you with their 2-year-old, right? So imagine that. Plus their husband's working from home and maybe grandma's staying with them. So a lot of families have started doing, and therapists, where they videotape and then you meet for like 30 minutes and you talk through that videotape and you help give strategies that way. Prior to COVID, that wasn't allowed. Okay, so some of this, no recording. I typically don't record my sessions because, and that's why I don't have anything fun to show you. But if I record, then it becomes part of the medical record, right? And so then it's protected medical, and then I have storage issues and I have to spend $1 million on the cloud, and it's just too much. So we don't typically record. Okay. But right now, it's really important to understand that if you decide to provide telehealth, you really need to check these things out prior to doing it, because it's going to change again. Okay, so pre-COVID, we had licensing, limited state adoption. There were states like Ohio, Illinois, that did not allow for telehealth. There were a lot of emergency declarations that happened after COVID. So I'm hoping things like that stay. Portability in AOTA, what that means is they're trying to make it so that if I'm licensed in Colorado and California, okay, I don't have to get a different license for if a family goes to Wyoming. They recognize my license. It's not here yet, but it's coming quicker than it was. They originally said 2024 for AOTA, and now it's looking like next year. So that's exciting stuff for me. So that gives us that portability. PT already has it, and ASH is in the process. So speech therapist is in the process. So currently, right now, because it's not here yet, I have to be licensed in the state I'm in and the state the client's in or the patient's in. So when I go to California, I have to be licensed in California and Colorado. Okay, so that's typically how it goes. Now, I just had a therapist call me, well, the family's going to Michigan for 2 months, but the state licensing department is closed down because of COVID. What do I do? You can't see the kid for 2 months, or you may have to refer to somebody else because that licensing is really, I don't know. I like my license. So reimbursement trends are positive. Big news during this COVID. This was going on for years. We've been trying to get Medicare to cover OT, PT, and speech, or OT and PT. Speech was already covered, sorry. We were trying to get Medicare to cover. Bam, through the COVID crisis, guess what? We are now covered to provide services via telehealth for Medicare. In Colorado, Medicaid was already on board. Some states, California, Medicaid is on board. Most of the time, Medicaid follows Medicare. In some instances, Medicaid was ahead of the game. And most private insurances have a telehealth benefit. You just bill the same as in-person services. Okay. Okay, I hope you guys can hear this. If you can't, somebody wave me down. This is the funniest thing I've ever seen. It's how not.
Oh, hello. Yeah, just give me 1 minute. Let's see here. Ray Barrett. And your date of birth? Okay. Okay. All right. So it's good to see you today. And can you hear me okay? Excellent. Yeah, so what brings you in today? All right. Hold on, let me jot this down. All right, let's see here. Oh, gee, hold on. I'm sorry, give me 1 second. Hello? Yes, I'm in a session. I'll have to get back right with you, okay? I'll give you a call back soon. Okay. All right, and your number? Okay. All right. Yep, I'll call you back in about 10 minutes. All right, thank you. All right, so where were we? Okay. Yes?
Hi, do you have the report for me? I was gonna send it out.
1 second. Yeah. Okay, there it is. And,
Okay, and it's all set?
it's all ready for you.
Okay, great.
All right, we'll talk
Do you
about
need
it soon.
anything else?
No, I'm all set.
Okay.
I'm good.
Thanks.
All right, thank you. All right, let me shut this door. All right, so here we are. Again, sorry about that. Let's get started here. Yes, so Ray Barrett, excellent. How can I?
Okay, you get the gist. Lots of things to think about, right? And I put the Padlet chat box, so if you want to copy it, you can get it. So everything that went wrong on that one, right? Besides the Batman shorts. So now the fun part. This is the fun stuff. So think about how you could use telehealth. Okay, remembering that it's not just one-on-one. Okay, and I think we're short on time, so we're not going to kind of brainstorm together, but I have some case examples that I think you might find interesting to kind of like help your brain open up and open up to the possibilities of how you can use this technology to support engagement in occupations. Okay, so here we have Chloe, who is an 83-year-old woman, recently admitted to an acute care hospital for an ORIF after falling while on a cruise to Alaska with her friends. This was pre-COVID. She is ready to go home from the hospital, but the OT is concerned about the barriers in her home. She lives with her son in a multi-level house in San Diego. How could you use telehealth in this example? I'm going to give you my ideas, but I want you to think about this, okay? One idea is you could be with the client in Alaska and her son could be remote in San Diego. You can bill for that time of transfer training or bathroom equipment, all of those things, because you're educating both the son and and Chloe. The other thing to think about is you'll get to see Chloe's home, right? So the son could actually take you around the house and show you what he's concerned about. And Chloe could say, you know, make sure you show them my bathroom and make sure you show them my bedroom because I'm concerned about going home, right? So that's how we need to think about using telehealth. One of the reasons. Okay, here's another example of a kiddo. This is a kiddo that I actually worked with. 6-month-old child with spina bifida and bilateral club feet. I was the only provider in on this case, but she had 3 caregivers during her week. And so what would happen was her dad worked in the correction system as a teacher, and he worked like a swing shift kind of thing. So he did teaching part-time and then also worked in the correction system doing other things. So he sometimes worked nights, and then he would have the little one, and then there was a nanny, and then mom was a teacher in a school district. So we had all these people, and I'm only one person. I couldn't come 3 different times during that week. So what did I do? So mom would take her lunch hour during our sessions, and we planned those sessions around that. So I was in the home with the family and mom was remote. Okay, so that's what I mean. You can open your eyes. How can we use this technology to support what we're already doing, right? Sorry, my dog barked. Okay, here's another one. This one I like. Joe is an OT in rural community who works outpatient. He's working with a 65-year-old client, Matt, who has chronic health conditions, diabetes, CHD. Matt lives alone in a camper, and he's been experiencing falls at home, has been inconsistent with his attendance in the clinic. Do you think telehealth can be used, and what are some of the things we need to think about? So we need to make sure he has a cell phone, right? We need to make sure he has access. It's really important. We need to make sure that he's interested in doing this, but the transportation could be the issue. And so by doing this at the home or in his home, then we wouldn't have the transportation. Also, we have to consider safety, right? If we're working on some of these balance, but how cool would it be that we could go into his actual home and see where those issues are for him, you know, and help problem solve in the moment. Oh, I see that your stairs to the camper, can we modify these? Can we make changes? Okay. I'm just trying to open your brain. That's all I'm doing. Susan is an OT who works with young adults who are experiencing challenges with substance abuse and addiction. She has noticed that many of the young adults are not able to make their appointments or must catch a ride due to the lack of transportation, or they have lost their licenses due to a DUI. She enjoys this work, but due to the high rate of cancellations, her program is in danger of being eliminated. This is a perfect opportunity to do telehealth. You have to be aware of groups. You have to be aware of privacy with adolescents, just like we would in person. Okay, so those are things that we have to be aware of. We can't do a group if the parents in the other room and could have access to other adolescents' information, right? That wouldn't be okay. Okay, OTs. Vision 2025, right? So telehealth kind of hits all these boxes. Way back in the day when I started working on the project that I was working on, it was Centennial Vision I was focused on, but Vision 2025, it's evidence-based, it's client-centered, it's cost-effective. Bam, checked all the marks. Influential in changing policies, all these policies that have been changed to allow OT to provide telehealth. Bam, we'll check that box. Complex systems, being able to navigate systems and have access to places that we didn't have access to. American Samoa, right? There's no OT on the island. So I'm it. Collaborative helps us work with clients in their systems to provide effective outcomes and makes us more accessible, okay? I could do a whole nother lecture on being culturally competent, but I'm not going to for today. So this is the future. So in the future, what do we need? We need acceptance, we need quality. We need quality in telehealth. I just put out my survey and I'm a little worried that it happened so quickly that people weren't able to be trained. And so we're not going to have the high satisfaction of the telehealth from the families and from the caregivers because it wasn't done well. You know what I mean? It wasn't done to in the coaching model. The parents felt like it was an extra stress. When I'm mentoring other therapists and I hear that, instantly I go, okay, how are you providing those services? Are you expecting the 2-year-old to engage with you on this computer screen? Because that's probably not going to happen. Are you talking with the parent about the coaching model? Are you using coaching? How are you doing this? So I'm kind of interested to see how that's going to pan out. But we need more evidence. We need evidence across settings and across populations and different areas. If you're interested, I'm working on developing a kind of learning group internationally with pediatric OTs across the globe who are using telehealth. And because of COVID are needing to learn and want to learn from each other. And so we're going to do that. So if you're interested,
it's 6 o'clock
and I'll send you the goodies on that. All right, so there are a couple questions. I work on my own doing telehealth. I have my own contracts with early intervention providers, so I get paid by visit. My pay is the same as it would be in person. So I have my own. I'm not sure how other people are doing it. I know a lot of school-based practices are going to telehealth. I know because of COVID, a lot of people have shifted to this type of service delivery. And then Laura asked about synchronous versus asynchronous. Did I understand the post slide to allow asynchronous? Yes. So right now we are allowed to do asynchronous because of the HIPAA requirements being relaxed. So that's where I don't really, what I typically did pre-COVID, if a parent, like a sleep routine was bad or something that the parent wanted me to see, I would have them share it during, just like I share screen, I would have the parent share screen. And then I would talk them through it during our session. I feel like that's a kind of a better way to do it because you're more, it's like a scheduled session. And I feel less squeamish about it that way because I'm not saving that information on my computer. So, and I was trained before COVID, so just be aware. Be aware. Be aware of who's in your room. Be aware of who's in their room. Be aware. Okay, any other questions? You can come offline. Sorry I talked the whole time. I really didn't think I would go the whole hour. I was shooting for 50 minutes, 10 minutes for questions, but you know, This is my favorite thing. And there's a lot to learn. And I wanted to give you some just ideas to kind of open the box a little bit for you. Thank you, Lindsay. Please go to the Padlet and feel free to share. I'm not picky. You know, I'm not going to be all, but share with your classmates the information. Don't be afraid of telehealth. I think a lot of you may go out to your fieldwork and telehealth may be happening. It's a great opportunity. You really have to be able to coach and teach. And so it really does help solidify some of the concepts that you learned in school by teaching other people. So, great. Feel free to log off, unless you want to chat.
Thank you very much. I'm going to stop the recording.
Thank you.
Thank you.
Thank you very much.